I've been having a lot of pain and symptoms on my left arm, left shoulder area for over a year now. And my neurosurgeon did kind of toss around the diagnosis of thoracic outlet syndrome. He pretty much wanted me to do a bunch of testing and see an orthopedic doctor for their opinion and also do some physical therapy. So I figured I would just be completely transparent and just talk about the testing that I've had done and the results that have come so far because it's very confusing. And I'm still on the road to trying to figure out what the heck's going on. So the first test I ever had done was an x-ray of my shoulder that came back completely normal. The next test I had done was an MRI of my brachial plexus and my chest. And the brachial plexus was left and right side. And that came back normal on the left side where all my pain is. But interesting turn of events, plot twist. It showed that I do have thoracic outlet syndrome on the right side of my subclavian vein and my nerves. Confusing, interesting, but my body is just like that. The next test I had done was an MRI of my shoulder and an arthrogram of my shoulder, and that came back normal. I also had an EMG and nerve conduction study done on my left arm, and that came back normal as well. Everything pretty much came back normal except for the brachial plexus MRI of the right side, which showed TOS. And although a lot of stuff is coming back normal, I have heard that that is kind of normal for thoracic outlet syndrome. It's very hard to diagnose, it's very hard to figure out. Things have been normal and not really showing up very well, but also isn't that kind of the case with most people? I've been doing physical therapy, trying to help with the pain. It has not really helped. I saw an orthopedic doctor and they pretty much said that they don't really know what's going on because it's not matching up with TOS exactly. I'm going to be seeing my neurosurgeon again. Maybe he will have some suggestions on what I can do or even figure out what's going on. I don't know what other testing they could do. It feels like thoracic outlet syndrome to me, but I'm not a doctor and I have no idea what's going on. So anyway, that's the update.